This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Clifford Hudis, the president of ASCO, the 2013 to 2014 term. Dr. Hudis is also chief of the Breast Cancer Medicine Service at Memorial Sloan-Kettering in New York City. Hello, Dr. Hudis.
Hi.
Thanks for making time.
It's a pleasure.
So let's talk about, well, I believe was the study, the cervical study you were referring to, was that with the Vinegar?
That's exactly right.
No one has talked about it, so since we mentioned it, do you mind talking about it just a little bit?
Well, of course, and it's really an interesting study on so many levels. This is not what you might have thought would be a typical presentation at an ASCO plenary session. In this study, a large number of Indian women where the standard screening for cervix cancer is no screening were randomly assigned to that or a locally deliverable, locally applicable tool that used vinegar to identify abnormalities in the cervix that might represent cancer. And when you think about what a screening test is really meant to do, it isn't really meant merely to identify cancer, although that can be an end in itself. In an ideal world, a screening test should not only identify the disease, but change the outcome. And here we have a survival advantage. The controversy about this that I think is interesting, of course, is that there is a standard screening test, the PAP test, and that was not the control arm of this study. So some will ask, why not? How was it ethical to not provide that? But it's crystal clear that the standard or control arm in a study has to represent what is actually used in that community. And we have to go back to the beginning and acknowledge that in this underserved portion of India, there is no screening. So it was nothing or this test. How it compares to PAP testing is something else. This raises one more really important global issue. All of this, or most of it, of course, could be made obsolete by wide distribution of HPV vaccination.
Thank you, Dr. Clifford Hudis, president of ASCO, chief of the Breast Cancer Medicine Service at Memorial Sloan-Kettering in New York City.
Thanks very much.